So female pattern hair loss is a type of hair loss that occurs in many women, usually starting from at the one end of the spectrum, from the teenage years to the older end of the spectrum, so postmenopausal. And female pattern hair loss is a type of hair loss that presents in a unique way. So a patient will often come in and say that I'm unable to style my hair in the same way because my frontal scalp is thinning. When I look in the mirror, I see that there is more scalp visible. My parting feels wider. I can't tie my hair back because the amount of hair within my temples is very much reduced. The patient will often say that I seem to be shedding more hair. And this pattern of shedding seems to be relentless. There seems to be no end to the amount of hair that I'm shedding. So a patient might say, I comb my hair every day and I've noticed that I'm losing far more hair on the brush or in the shower than I did 5 years ago. So female pattern hair loss, although genetic factors do play a role, is primarily caused by sensitivity to the most potent form of the male hormone testosterone, also known as dihydrotestosterone. And what happens is that the receptors on the scalp become very sensitive to this hormone. And as a result, the testosterone will fill the receptors and cause shrinkage of the hair follicle. Often with female pattern hair loss, it's not the number of hair follicles that are the problem, it's the quality of the hair shafts that are being produced by these follicles. And the overall effect is to reduce the volume and the look and the quantity of hair on your scalp. Female pattern hair loss can be treated in women of all ages, although the treatments might be slightly different for younger women than for older women. And these may comprise of hormonal treatments, topical applications that are applied to the scalp, and also bearing in mind the patient's expectations of what they would like to achieve as the end result. Every patient is an individual, and thus an individualised approach is required to treat female pattern hair loss. But what I would say to my patients is that they must not despair, because it is a treatable condition